Hello, everyone. Welcome to the Dr. Thyroid podcast and the RFAMD podcast. I am Philip James. I'm your host. Today's guest is Dr. Vaninder Dhillon from Johns Hopkins. She's an endocrine head and neck surgeon. Dr. Dhillon, welcome.
Thank you. Good to see you.
That's the short title for your work. Can you share with those listening a little bit more about your work and your background?
Sure. I work as an assistant professor in the Department of Otolaryngology or head and neck surgery at Johns Hopkins. I'm part of the divisions of endocrine head and neck surgery, so primarily focused on surgical management and intervention, minimally invasive intervention for thyroid and parathyroid diseases. I also am part of the division of laryngology, which focuses on voice, swallow, and breathing. So it's a combination of both clinically.
Great. Well, thank you. And today's topic is what happens when there's multiple thyroid nodules, and can they be treated with ablation?
I think this is a great topic for conversation. I know many of us, including myself, have patients that for benign thyroid nodules, when there are multiple, come in with questions about whether or not an ablative treatment is right for them, so that when they are done with the treatment, they feel that they have improvement in symptoms that bring them into the office in the first place. And so I think that for the majority of patients, when we talk about ablation, we like to say that most benign nodules can be treated very nicely with ablative technique and successfully with good volume reduction. But when there's multiple nodules that could be potentially causing more maybe compressive symptoms, such as problems with swallowing, problems with pressure, discomfort in the neck, pressure or discomforts that include with lying flat or changing position, maybe even some voice complaints or throat tightness. These are all symptoms that if we're looking at the thyroid and multiple nodules, we have to be mindful that if we are going to do ablation, we're going to treat those symptoms such that the patient has improvement. So it's a great topic to delve into.
So let's unpack it further. Let's start here. How common are thyroid nodules? And when you look at the, say, American population, what percentage has thyroid nodules?
They're very common. There's a pretty high rate of them, anywhere between 30, I think, to maybe 50%. Patients have some form of a nodule in their thyroid, whether there be one or multiple, and could be very small in size or anything that's not even noticeable on physical exam, maybe picked up on an imaging study. So that sort of encompasses a pretty high prevalence of nodules in our population in the United States. And part of that is just the detection technologies that we have, so we can pick up on thyroid nodules. So they're very common, and over 90% of them are benign.
Okay, so that was going to be my next question. So let's say 30 to 50% of the population has nodules. How does a patient discover there is a nodule?
There are many ways. Again, given the fact that we have such innovative technology now and such sophisticated detection systems like ultrasound, CTs, MRIs, a lot of these nodules are being found incidentally. So they may be picked up when a patient has gone in for another procedure or for another imaging study for something else. And if they're not caught incidentally, then they're typically either felt or noticed by the patient, which brings them into the doctor. So either a lump on the neck, a sensation of pressure, or a lump sensation in the neck that wasn't there before, or when going into the doctor's office, they're having a physical exam done, and the physician themselves, when doing the thyroid exam, may feel a nodule, in which case the patient is then made aware that they have one.
And then for people who have a thyroid nodule, how common is it that there's multiple nodules?
Yeah, that's a good question. I actually don't know the exact number, but it's not uncommon to have multiple nodules, or what we call multinodular thyroid. So it's not an uncommon thing, but in terms of the significance of that, it really depends on the size of nodules too. So patients that have multiple nodules, they can be multiple on one side of the thyroid. They can be multiple on both sides of the thyroid. They may be of multiple sizes with a dominant or the largest nodule. So it can be very variable.
And for people that either have a thyroid nodule or multiple, if 30 to 50% of the population has thyroid nodules, how common is it that it becomes problematic, and when does it become problematic? Because probably a lot of people end up with thyroid nodules and don't even know it all their life. When does it become a problem?
Well, typically the types of symptoms or concerns that bring patients into the office are really cosmetic and compressive concerns. So we're again really focusing on, if we're talking about multiple nodules, if we're talking about multiple benign thyroid nodules can exist and they can be followed, but patients that may come into the office sooner are those that include patients that have either a change in appearance of the neck, so they notice and that there may be a cosmetic asymmetry or difference because one nodule is bigger, or there's a size change suddenly with the nodule, or there's new symptoms of compression. So as I mentioned before, there can be a lot of pressure sensations in the neck, either against the trachea, which is the windpipe, or the esophagus, so problems with swallowing, voice changes, pressure with position. So very typically when lying flat or moving the neck, they can feel or sense a difference in how their throat or their neck feels.
So for these patients, let's go back 3 years ago. The probably immediate treatment method would have been surgery. Okay, so now a patient comes in, has multiple thyroid nodules, and they can be treated without surgery. Walk us through that.
Yeah, I think these are the great questions now to ask, because these are patients that we are seeing very much coming into the clinic, not desiring surgery in order to preserve the rest of the thyroid, which is functioning normally, and therefore don't want to have to undergo surgery because they don't want to have to worry about being on thyroid medication or losing part of their thyroid, which is otherwise functional, which is totally understandable. I think when it comes to multiple thyroid nodules, there are a couple of things that we like to consider, especially in regards to the overall anatomy as well of the thyroid. So it's one thing to have thyroid nodules, but we also need to look at the size of the overall thyroid gland, which is very different than the size of the thyroid nodule. Nodules are actual growths within the thyroid gland. So they're actually part, not separate technically, of the thyroid tissue. So they're one and the same, but they're within the thyroid gland. So for patients with multiple nodules that may be large, but the thyroid gland overall is relatively small, when we talk about ablation, those patients are typically good candidates because we're getting volume reduction in a very directed intervention to the nodule, such that that volume will reduce, the size of the nodule reduce, and we hope that those compressive symptoms will be directly improved because of the reduction in the nodule size. And again, this is for a patient with a large nodule or nodules, but a relatively small thyroid gland. The other side of that coin is that patients that may have an enlarged thyroid. So if we're looking at the overall size of the thyroid and it's, either by definition a goiter, or it has extension beyond the neck, but doesn't include the nodules themselves, and that patient's coming in with nodules as well as compressive concerns, we have to evaluate whether or not treatment directly to those nodules is going to affect the overall symptom that's bringing the patient in. So a patient with a large goiter with multiple nodules, if we ablated the nodules, there still may be some compressive symptoms because we're not treating the thyroid gland. That the gland is intact. It's the nodules we're directly treating with the ablation. So for some of these patients, we really have to sit down carefully and explain these differences and see if whether or not the ablation and that volume reduction in the nodule itself is going to lead to improvement in their compressive symptoms, or if it's really a gland, the size of the gland is the issue, and we may need to discuss potential surgery in that case.
And can you do ablation for multiple thyroid nodules when they are malignant?
So in terms of malignancy, I think, the guidelines at this point would recommend that, for primary treatment of thyroid cancers, at least here in the United States, surgery is recommended, but because we want to remove the cancer. But for patients that either cannot undergo surgery or have had multiple surgeries or have persistent disease, even in the neck, so not necessarily thyroid nodules, but lymph nodes. But if they have recurrences, for example, in the thyroid bed, and they're, again, not necessarily nodules, but recurrence in the neck, then yeah, they can be treated effectively with ablation if there's multiple sites. Now, we have to be mindful that if there are multiple nodules or multiple sites of treatment, even in a cancer situation, that if we're going to be doing both sides of the neck, we may want to stage that because there are risks of injury to other important structures, such as the nerve to the vocal cord, large vessels, the trachea, the esophagus. So those are things that we can still treat the multiple nodules or both sides, but we may want to do it in a staged fashion.
So for those listening, it may come as a surprise to hear that, in fact, if they have multiple thyroid nodules, that surgery may not be necessary. That's correct, yes?
Yes, depending on the factors of the thyroid gland itself and the size of the gland. If the nodules themselves directly are affecting the patient's symptoms, so we have a direct correlation between a large benign nodule and the patient's symptoms, then treatment for that nodule itself with ablation should effectively treat the symptom.
So I'm just going to state it again, just because for some listening, this is kind of a new paradigm that, in fact, surgery is not necessary or always necessary to treat a thyroid nodule or even multiple thyroid nodules, which is great news.
Mm-hmm.
And in some cases, even when there is cancer present, they can get treatment for that thyroid nodule that doesn't involve surgery or removing the thyroid.
Mm-hmm.
That's great news.
Yeah, I think, again, this is a intervention that is changing the way in which we treat patients. So there's very directed approach now to the disease or the nodules in question without having to sacrifice the rest of the thyroid. So it's definitely something that patients should seek consult for and discuss further with an expert in the field, because the treatment interventions are changing. And so if patients are seeking that, then there are definitely options for them to speak about without having to go through surgery.
Great. Well, your contact info will be listed in the description to this episode and this video for those who want to reach you. Any final thoughts before we say farewell?
Final thoughts that I have is, if you have multiple thyroid nodules and you're interested in ablation, I think that is something that you can, seek a good opinion about, because multiple thyroid nodules can come in different sizes and can come in multiple, sets. So it's not an exclusion criteria for ablation. It's actually an inclusion criteria. So I think for those listening, if that's you, then you should definitely seek more information about that.
Great, Dr. Dhillon. Thank you so much.
Thank you.
See ya.
All right. Thanks, Philip.